The Gold Coast Health and Wellbeing Plan is a shared vision for the improved health and well-being across the Gold Coast. This affects the geographically aligned boundaries of the Gold Coast Medicare local region, including Tamborine, Canungra, and Beechmont. The Gold Coast Health and Wellbeing Plan comprises of 6 strategic priorities, which are outlined in this table. I will continue on to further details in the coming slides. Priority 1 is to support people to make healthy choices and take an active role in preventing illness and maintaining good health and well-being. This is a priority because many of the common causes of chronic disease are modifiable and can be mitigated. Currently, action is being taken at all 3 levels of government as well as non-government organisations to help people make better health choices. This includes campaigns such as Quit, Swap It, Don't Stop It, 10,000 Steps Australia, Stay on Your Feet, and many more. Further initiatives include strategies that specifically target people of lower socioeconomic status, effective immunisation programs, gaps in services, and more screening services. In the plan, there is an outline of how outcomes of the initiative will be assessed. For Priority 1, this includes measuring exercise levels, data collection on cancer screenings, and childhood immunisation. Further evidence for this priority is the Get Active Gold Coast have identified that 20% of participants think 1 hour of physical activity 3 times a week is required. Priority 2 is better access to services, programs, and information, particularly for those most at risk. In summary, this is a priority to address the streamlining of referral pathways, the increased knowledge of services, and equal access to services to prepare for population growth and to allow for a more holistic health service. What is currently being done includes Friends of Headspace Youth-Friendly Project, Gold Coast Homelessness Community Action Plan, web-based referral pathways, and extended GP hours, and more. Areas for implication and exploration include web-based portals as a single point of service access for information and up-to-date population health information. Priority 3 is to strengthen the role of non-government service providers and community groups to support people to look after their own health and well-being and positively influence health outcomes. In essence, the priority looks to address the limited support for non-government organisations. Providing health and well-being modifications, this will unload the existing health service system. Evidence shows that community groups are effective in increasing community participation. Currently, there is a range of existing support groups, including locally developed groups and others controlled through state and national peak bodies, including Chronic Condition Self-Management Project. Areas for implication and exploration include the establishment and maintenance for self-help, self-management groups and web-based functions to support self-management for people with health conditions. The aim is to measure the support and resourcing of community-based support groups and the geographical spread. Priority 4. Inspired, skilled workforce and flexible workplace. It is well known that there is a national skills shortage in health, an increasing trend in the complexity of treatment issues. Areas for implication and exploration include the continuation of implementation and further progression of the Workforce Action Plan. Attempts to remedy this include the Workforce Advisory and Action Group and its Workforce Plan, and will be further evaluated on the delivery and shared mental health training and progression of Workforce Plan initiatives. Further evidence for this priority is that Australian Jobs 2014 has concluded that only 18% of full-time employed workers have a bachelor degree or higher, compared to the 49% who have not had a post-high school qualification. Priority 5 focuses on high-quality, people-centered services and providing support to clinicians and service providers to achieve this. Health practitioners are required to have a patient-centered approach, which is outlined in ACSQH, list of key principles for consumer, and supported by the World Health Organization, and further supported by national safety and quality health service standards. Areas for implication and exploration include developing tools to measure health literacy and develop a method to gather consumer and carer feedback on services. Data will be analysed on the development and implementation of policies and patient experiences. Further evidence of this priority is that general social care found that promotion of independence of service users while protecting them as far as possible from danger and harm had positive outcome on patient-centered approaches. The concluding priority is centered around the improved coordination, integration, and communication in service delivery to include patients that require several health and community service providers, particularly for chronic and complex services. At the moment, there is a number of initiatives and programs and committees which focus strongly on improved coordination, integration, and communication across health and well-being. Areas for exploration include effective care coordination process for people with complex health issues and the transfer of patient information through secure electronic communication channels. These priority outcomes will be calculated by the satisfaction of referrals from other service providers and the consumer feedbacks. In the most recent review, it is written that the only areas that currently have measurable increases is exercise levels and cancer screenings, but this could be due to many programs being in their infancy of implementation.
So after getting an idea of what the plan is focused on, let's take a look at what this means for us as physiotherapists in the Gold Coast community. The first being our role in preventative care, encouraging people to make healthy choices to reduce comorbidities. Apart from the treatment of musculoskeletal conditions, physiotherapists have a well-established role to play in the treatment and maintenance of chronic conditions. This needs to be a team effort, drawing from all health professions that deliver services reflecting the local community's health needs. As physiotherapists, we have an extensive knowledge regarding the benefits and prescription of exercise. In 2010, 49% of residents within the Gold Coast Medicare local region were overweight or obese, and only 58 did sufficient physical activity. We know there is extensive evidence that demonstrates exercise reducing the prevalence of cardiovascular disease, type 2 diabetes, osteoporosis, obesity, depression, and cancer of the breast and colon. In addition, it is important to spread awareness of health-related issues involving smoking, alcohol use, proper diet, and skin protection from the sun. One of the most comprehensive online health and community service directories was established to help Gold Coast residents find the services they need when they need them, day or night. This provides a single point of service access featuring over 1,000 listings, allowing residents of the community to find readily accessible and up-to-date information. This attempts to resolve the issues of people not being aware of the available services because information was not easily obtainable. As physiotherapists in the community, it provides us an additional tool to promote our services to those who are in need. One of the most important aspects of physiotherapists and health professionals as a whole involves the continued development of our knowledge and skills. The plan hopes to provide shared training available for staff across sectors in key priority areas to address common issues such as effective coordinated management of chronic illness and disabilities. Twice yearly, the Allied Health Forum is held. This free forum provides the opportunity to network and enhance working relationships as well as undertake professional development. Speakers will present issues of relevance and importance to allied health professionals in regional and rural areas, particularly with regard to the changed health landscape. The Primary Health Care Improvement Project is another program to progress the development of allied health professionals. The vision of this project is to implement evidence-based change supported by sustainable business modeling, systematic review, and best practice clinical guidelines with the aim of improving the coordination and management of care for patients in the primary healthcare sector and reducing preventable hospital admissions. From an allied health perspective, there is an increased access and communication with other primary care providers. Since its conception, there has been a 60% increase in the completion rate of initial reports back to GPs and a 35% increase in the completion rate of final reports back to GPs. Increase in the amount of paperwork received at the time and patient referrals, and a 17% increase in the number of GP and hospital referrals. One of the causative factors for this improvement is the increased communication between health professionals. The Gold Coast Medicare Local will support care coordination through e-health initiatives to assist service providers, such as physiotherapists, to adopt effective care coordination processes for people with complex health issues. A personally controlled e-health record is a secure online summary or electronic record of a patient's health information. The patient has control over what goes into it and who is allowed to access it. The e-health record system will ensure that healthcare organizations have faster, easier access to patients' health information by allowing hospitals and health providers to share important information on the e-health record. This will make continuity of care more seamless and will improve treatment decisions. To further support our profession locally, the Gold Coast Medicare Local Allied Health Advisory Group was established and meets monthly to provide strategic direction and leadership with regard to primary allied healthcare. This group serves as a reference body to provide evidence-based information and contemporary practice methods to the Gold Coast Medicare Local Board and subcommittees. It is a collaborative way to discuss issues, share ideas, and information to progress allied health services and identify emerging issues. This ensures that us as physiotherapists are being properly represented and advocated on a local level, making sure that the residents of the Gold Coast region are optimally cared for. In summary, the Gold Coast Health and Wellbeing Plan aims to guide and inform service development and investment across health and the community services based on sound evidence and local needs. Due to relatively recent implementation of various health programs, there hasn't been sufficient time to effectively evaluate a lot of them. However, with that being said, this plan will influence how we will practice physiotherapy within the community here in Gold Coast, providing support and direction to provide optimal care.